Welcome to Growth and Inspire, where we examine topics that make us feel inspired and grow. I'm your host, Bonnie Yam, and we will be posting frequently on topics to help you grow. It can be issues involving new regulations, taxes, or planning for retirement cash flow. We hope to bring you insights, discussion points, drill down on complexity to make it simple. Join us on this journey as we will have a lot of interesting guests, such as insurance experts, healthcare insurance experts, tax and finance professionals. And don't forget to subscribe and leave us a review if you enjoy what you hear. Now, let's get started. Today's episode is Medicare. We're going to talk about, we're going to have a quick discussion on the key issues of Medicare. And my partner today here is Daniel Hope from VNS Health. Hello, Daniel.
Hi, Bonnie. How are you? Thank you so much for having me.
Great, wonderful. So happy to have you on our podcast. Now, before we start, can you tell me a little bit about yourself and your company?
Of course, of course. So again, thank you so much, Bonnie, for having me on your wonderful podcast. So my name is Daniel Hope. I am the broker account manager for VNS Health. All right. So what I do at my company is I basically oversee and act as a tool for brokers to be able to reference whenever they have any sort of issues, any sort of concerns, or any sort of needs when enrolling clients into our amazing Medicare Advantage plans.
Wonderful. So you've heard a lot about the issues, their problems, and you help them solve the problems, right? Wonderful.
Correct. I'm very well in tuned with a lot of brokers such as yourself, Bonnie. But the thing is my scope goes to about 750 brokers, and we oversee the entire downstate as well as Westchester, the capital region, and next year in 2025 we will be expanding to Erie and Monroe counties.
Nice, nice. All right. So, any questions? Like, let's just get started. Okay.
Okay, let's definitely get started. All right. So I'm gonna ask you the questions, and then as you are the Medicare insurance expert, and then I'm just gonna talk briefly about VNS Health towards the end. All right.
All right. Okay.
So Bonnie, as this VN or as the Medicare extraordinaire, what is parts A, B, C, D, Medigap, or supplement policy?
Thank you. I get these questions all the time. People said that I'm turning 65 soon. So, Bonnie, what is ABCD? All right. Okay. So, part A and B is called original Medicare. A is hospital, and B is medical insurance, which covers outpatient, doctor, and preventive services. So, those are your regular go to services, right? A
Correct.
is normally free if you or your spouse has worked and paid Medicare taxes for at least 10 years or 40 quarters. Part
Okay.
B is not free. You have to pay. The premium for 2024 is $174.70 per month. And that's not really expensive. You compare private insurance, it's like 35, 10 times, a lot more. Okay. So it has always, but that's not the only thing that you pay. There's also a deductible of $240. And then anytime when you see a doctor, there's also co-insurance, which is 20%. So if it's $100, you pay 20% of that $100, $20. And Part C, now Part C is a little different. Okay, Part C is private. Okay, Part A and B, okay, it's called original. Basically, whoever you want to see, so long as they take Medicare, you can go see. Part C is private insurance. So when you subscribe to a private insurance, they kind of filter out the doctors they want to put in the plan. It's not everybody. It's locational based. And in order to be eligible for Part C, we call it Medicare Advantage. You had to pay for Part B premium. So you had to pay that $174.70. And then maybe there's another premium for Part C. Depends. But it's normally not very expensive. It's low or maybe zero. Okay, all depends. And then the benefit, so you say, why? Okay, so why am I paying, more, if I already paid for the Part B? The reason is, okay, so Part B, also, on top of that, it's locational based. So if I join Part C, Medicare Advantage, It just only like where I live, Westchester, so it's Westchester base. Okay, I can't go to California. Sorry, you can't do that. It will be another plan. Okay, and the reason, the advantage is that it covers Part A and Part B, all the services. That's the minimum. And on top of that, it gives you, a lot of them gives you dental, vision, hearing, maybe even acupuncture or transportation advantages, pickups. So, you're getting more. And then another big benefit is that it has maximum out of pocket. So for that 20% co-insurance that you're paying for Medicare, part B, it can be a lot of money if there's no upper bound. So this one,
Exactly.
5,000, 7,000, depends on the plan. About 7,000, that's your max out of pocket. So once you exceed that, you have to pay. So that's another insurance over, all the services. So that's a great part. And then the other thing is Part C sometimes include, well, we haven't talked about it, Part D, which is prescription drugs. The original Part A, Part B, we said hospital. Part B is what? Doctors, right? So what about medicine? All right. So you had to buy Part D, prescription drugs. That's Part D. So if you do Part C, sometimes it's also include drugs. So you get all these advantages all wrapped into one. How nice, okay? So one plan instead of, oh my God, I need to pay for Part B, I need to find my doctor, and then when they need prescription drugs, I need to first pay for the premium and then some more copay for that co-insurance. So it's complicated. So more and more people wants to get into Part C just because of all those additional advantages, all collapse into one plan. So we talk about Part D, that's prescription drug, and there's also premium, copay, co-insurance, all that stuff, right? And then another one, the last one is supplement insurance, or sometimes we call it Medigap insurance, and that's if you have original Medicare, which is Part A, Part B, and then we said that's 20% copay or co-insurance, that's out of pocket, that can be a lot of money. So sometimes they might be interested in purchasing additional insurance that we call supplemental insurance to help you pay for something that's not being covered by Part B. That's out of pocket Part B. Okay.
Okay. All right. Perfect. I really did love that explanation. I did remember we were talking about enrollment periods earlier. I definitely would love for you to just explain that a bit more for your listeners. So, what are enrollment periods?
Thank you. It's okay. It's also complicated. I don't know why they want to wait. It's so complicated. All right, so there's initial enrollment period, or we call it IEP. Okay, so when you turn 65, 3 months before you turn 65, and your birth month. So 3 months before your birth month, and then 3 months after you turn 65. Altogether, 3 plus 1 plus 3 is 7. So 7 months. Okay, that 7 months we call initial enrollment period. And that's when you first turn 65, you can enroll, okay, into Medicare. All right. And then there's another one called special enrollment period. Something happened in your life, whatever, you move, you get married, and you lost your healthcare coverage, or maybe you qualify for extra help for Medicare drugs, then you'll be able to enroll under SCP. So that allows you to maybe change your plan. That's another way to get in and take a look and see what's best for you out there. And let's say if you did not do IEP, you not qualify for SCP, okay, there's another general enrollment period. And that happens between January to March 31st every year, okay? And all depends whether you have creditable coverage. If you don't have creditable coverage, you might have to pay some penalty. But if you miss those periods, that's when you enroll.
Got it. Got it. All right, perfect. That's a great explanation. All right. Speaking of enrollment periods and, things related to time, what, if there are any, would be the penalties if you enroll late?
Okay. So if you don't have credible coverage, okay, and you did not enroll, okay, this is insurance. Okay, somebody has to pay for expenses. The later you enroll, I mean, somebody else is helping you subsidize some of the costs that you're not paying, because as you get older, the expenses are more. go higher and higher, right? So there is a penalty. Part B penalty is 10% for each 12-month period. So 10% might not be a lot, but that 10% stay higher, that elevated 10% for the rest of your life. Like anytime. So once you're in the Part B, Medicare, you will have to pay the extra 10%. So 1 year is 10, 2 years is what? 20. So it adds up. Yeah. And if for Part D, you also have a penalty that's 1% for each month. So actually 12% if you look upon that. And it's also the same thing. It stays for the rest of the time, for the rest, your whole life. Yeah. So once you get Medicare.
Okay, great. Thank you for that. How do we go about choosing a plan? Or I shouldn't say we. How do your clients go about choosing a
That
plan?
is such a great question. It's pretty complicated, and it's absolutely no right answer. It all depends. All right. So first of all, you want to know whether I want to go into original or Medicare Advantage. Original will give you more choices, but of course more expensive. Right? So, and there's no max out of pocket. Okay. So if I want to be able to tap into Medicare anywhere within the 50 states of America, so yeah, go by all means, original Medicare. But if I am old, I don't think I'll be moving out so much, then maybe Medicare Advantage would be for you because there are a lot of extra benefits we talk about: dental, vision, hearing, so forth, and maybe gym membership. Now, but because this is location based, you need to think, would that matter for you? Okay. So, and then also we talk about Medicare Advantage always have an out of pocket maximum. So that also reduces the risk for you. And then so you need to also think about, if I really want to do original Medicare, so I might have to buy extra dental. Maybe I need at least dental is teeth is very important, and I want to test my eyes every year. Get glasses, So I mean, they all add up, a couple $100 here, a couple $100 there. So if I have a plan that kind of roll in all the benefits that I need, that'd be great. And then also add in drug advantages too. So I think it's really dependent on your convenience, affordability, and where you live. Do you have like a good Medicare Advantage plan? Yeah. So, and then after that, okay, after you decide cost versus all those benefits, the next thing you want to do is within that location, there could be a lot of providers. Maybe Humana, okay, maybe BNS, okay, Health First, there'll be a lot of providers. So what you want to do is like, what are the doctors that you see? Okay, you want them to be within network. Why? Number one, you always want to see the same doctor because they know you very well. You've been with them for 20 years, okay, so forth.
All right.
And if it's within network, it's always cheaper than out of network. All right. So, and the other thing is like you want to make sure that the drugs that you're taking is covered by the plan's formulary. Okay, so
that is important.
Yes, correct. It can be if it's not classified generic, or like if it's name brand, it could be very expensive, and even name brand their tiers. So you want to make sure that you do some quick calculation because there are a lot of software that can help. You type in the amount of medications you take, the name of the medication, and they will calculate how much it's going to cost you the whole year. So you know how much you pay. So if I stay with this plan, $60. If I stay with that plan, $200. Oh my God. And they might even, some of this have like deductibles. So before they even help you pay, it's like $200. You have to pay $200 before I help you pay anything. And the other plan said no deductible. And that's like already saving $200. So
exactly.
There's a lot of factors. So you do probably need to talk to a broker to just get all those facts, in one place, check all the total expenses and calculate and see if, first of all, the total cost, out of pocket cost, and that you're getting doctors are all in the network, and then you look at all those additional benefits. Flex cards, free OTC benefits. They're very competitive out there, but I wouldn't put them number one. Most important, making sure that the medications and your doctors are being covered and you're happy with the service. Okay. Oh, another thing is that all those plans, you can go online and take a look at the 5-star rating on the plan, right? Yeah. So you can go online and Google. Okay. So how is the plan doing? Customer service wise, plan providers, like, how are they ranking? 4-star, 5-star, 3-star? That helps you make a good decision. Anything else to add?
So, correct. No, I think that was explained very perfectly. And just finish that off. Where can they go see that information? I believe it is on the CMS website, correct?
I think so. I'm not quite sure, but I think so. A lot of stuff is available on CMS website.
Correct. And once you turn 65, you do get that CMS booklet that provides you with that information.
Yeah,
So
yeah.
perfect.
It's pretty
Perfect.
big book too.
No, Bonnie, I'm gonna delve out of my area of expertise and let's talk about financial assistance because I'm an expert at Medicare and Medicare with VNS Health. But can you talk a bit more about financial assistance? If I need financial assistance,
With
where do
people,
I
right?
go?
All right. So just say multiple ways, but the if you're low income and you don't have a lot of assets, I would say try to see if you get qualified for Medicaid. So even your drugs will be taken care of. A lot of those out of pocket expenses will be cut down to pretty minimal. So okay, so I would do Medicaid, but the numbers are pretty low. It's like about 20 something, $30,000. Like, it's like not very high. Okay, income and resources. You can spend down and get qualified, but it takes some time to get to that stage. And I know a lot of people who really do have money, and maybe their drugs or whatever, the hospital expense is so high, they want to lower the income, so their estate. So they work with somebody, maybe a Medicaid planner or an elder law attorney, and they put the money in a qualified income trust, or they call a miller's trust. And now that's very complex. So if you actually do want to look at that as an alternative, I would recommend seeking out for like an expert in that area to assist.
Okay, perfect. Perfect. I definitely would be reaching out to you just to, guide me in that specific field, mainly because, I do have clients who are what do you call it? Who are interested in that type of
Please check
that
this out.
section of the business. So I'm definitely going to be sending them over to you, Bonnie, because you are very experienced in that field.
Thank you so
All
much.
right.
So I actually know, like, we waited so long. We'd love to hear you talk a little bit about VNS. All right. So
Okay.
tell us. I know, like, I mean, standard benefits. Now tell me all this extra why, like why compared to all these other plans, VNS actually would be a great consideration.
Okay. All right. So thank you so much, Bunny. You experienced the basics of Medicare. You summed it up absolutely perfectly. I'm not gonna spend too long talking about VNS Health. Um, but what I can say is that VNS Health is one of those companies that is on the rise. All right. We have emerged into the Medicare industry about 3 or 4 years ago again, because we were part of the Medicare industry, for quite a few decades. But we got back into the business about 3 or 4 years ago. All right. We opened up our internal sales team as well as our external sales team, which I oversee, and we have been reaching all the communities downstate. You have the five boroughs. You have Nassau and Suffolk in Long Island. You also have Westchester. You have the capital region, and next year you will have Monroe and Erie counties. All right. So our agents, both internal and external, they reach those areas just to make sure that clients and potential clients are aware of what VNS Health offers. What does VNS Health offer? All right. So we have been known for our nursing and our long-term care because we are one of the top uh long-term care companies in New York State. We're fully local, but we still hold that title. We are one of the top long-term care agencies in New York State. All right. But as we are in the Medicare field, VNS Health has been making strides. They have been making huge efforts in making sure that we compete with the other carriers. The other carriers are very respectable. All right. We we look at them, we learn from them, and we try to be better than them. All right. Our benefits for 2024 have been absolutely exceptional. Okay. We've been very competitive in our benefits in comparison to a lot of the other carriers and a lot of the other major carriers. All right. For example, let's talk about our OTC. What is the OTC? The OTC is the over-the-counter card. All right. And that allows you to purchase items in the pharmacy as well as in the supermarket or grocery store. All right. Our OTC is one of the highest, if not the highest, out of all major competitors. All right. For 2024, and we're confident it will be amongst the highest for 2025.
What's it?
Okay.
What is it? What's the amount? I think it's like something like that. It's very high. Yeah.
Exactly, exactly. That benefit is gonna come out later this week. I just can't really discuss it. All right. Maybe by the time this gets published, it will be out. But as of right now, which is the 19th, we won't be able to do that.
I also know that something very interesting is that you provide overseas, like out of the United States, okay, Medicare emergency and urgent care insurance. That's nice.
Exactly.
So if I travel, I don't have to worry. I
Exactly.
don't
Thank
have
you
to
so
pay
much for
additional
bringing it up.
insurance. So that's like that was like immediately catches my eye.
Exactly. Thank you so much for bringing that up. So that's our emergency coverage benefit, and that covers up to $50,000 in emergency and urgently needed services
Great.
if you are outside of the United States or its territories. All right. So
Yep.
how that would work is you just go to the ER or you go to an urgent care in another country, and once you handle your business there, you come back to the US and we reimburse you. Just like any other plan does, we would
A
reimburse
lot
you
of money,
for
50,000.
whatever amount up to $50,000. Correct.
Yep. Fantastic. Yeah. I love it.
All right. You also have some of our other, value added benefits. I spoke about the OTC, which again is one of the highest this year. It's 225 on our dual plan. So if you have Medicare and Medicaid, you would be able to, or you're eligible for $225 on your OTC. All
Mm,
right, that's a
nice.
whopping 225.
That's a lot.
Okay.
That's a
You
lot.
are
You pay
exactly,
a lot of
exactly. Thank you, Meta.
money. Free money. I like that.
Exactly. And then for dental, our dental is also a major eye grabber. All right. Or
Oh,
it's what do you call it? It's one of the most attractive benefits
yeah.
for 2024.
Wait,
All
so
right.
it's the
We're
in plan benefits? What is it? It's like something that's very big.
exactly.
Ah,
Exactly. All right. So our dual plan or our Medicare and Medicaid plan that covers $2,750 and that covers implants. We also have two other plans if you have Medicare and they also cover implants. So all of our Medicare Advantage plans cover implants. So for all of those listeners out there, if you need any extra money towards, obtaining those dental implants, VNS Health
I know.
will
It's
cover you.
great. It's not just cavities, okay, or regular preventive checkups, implants. I'm old, okay? I need some of that.
Eh,
So
Okay,
that's
okay.
great. No, thank you so much. All right.
Of course, of
Yeah.
course.
So anything else? No?
Yeah, so we have, a bunch of other benefits. We have our vision, we have our hearing. They're all very
Yeah.
attractive.
Anyway.
VNS Health also has its Flex card, while other carriers decided to eliminate the Flex card,
Mhm.
we decided to introduce the Flex card for our dual eligible population. All right. Again, dual eligible guys, that means Medicare and Medicaid clients. All right. The Flex card covers extra expenses for dental, for vision, for hearing, and for utilities. Don't think we forgot about your utilities, guys.
Mhm.
If you have utilities and you would like to, get the help regarding it, just join VNS Health and we would be able to help with utilities. What are utilities? You have your cable bill, your home phone bill, your home electricity
Good.
bill, home water, home gas bill, even if you have your cell phone. All right, guys, and you would like to pay that bill, we would be able to cover that with our Flex card, guys. So the
And
VNS Health benefits for 2024 are absolutely exceptional. And next year, I don't know what is more than exceptional, but that
that
will be VNS Health.
And I know that if you don't use it up this month, it can carry forward to the next month. So you don't waste anything.
Exactly.
That's really good. Anyway,
Exactly.
so that's great. Thank you so much. No more questions, right? So that's it for today's on Medicare. And if you need any assistance selecting a policy, you can let us know. And I just want to say the annual enrollment period is about to start soon. Okay, it's October 15th to December the 7th. So if you want to change your plan, you want to find something that you like to explore, this is the time to take a look. And if you have further questions, please always reach out to us. So thank you very much for joining us. And if you enjoy the show, please leave us a review. Your feedback helps us reach more listeners and improve our content. And don't forget to like us on our social media. If you have any questions, comments, topic suggestions, feel free to reach out to us. We'd love to hear from our listeners. And join us in our next podcast will be cash flow investment for retirement. It's something we all want to know more about. Let's keep learning. Until next time, stay inspired. Thank you very much.